So I'm actually probably a very good example of probably a mid-40s guy, very active, have done sports my whole life, and got to the point, which we all do, where you end up wearing out certain parts of your body. And for me, I've always had bad knees. I had a couple of ACL replacements on one knee. I had debridements and cleanouts on the other, and that all is actually pretty much pales in comparison to what happened about a year ago, where I was hiking in Yosemite actually, and got to the point where I actually could not hike downhill, couldn't walk downhill without extreme pain. I knew something was really wrong. Went and did the usual checks with the orthopod, and as it turned out, the suggestions that I had was for a knee replacement. As I said, I'm actually 48 years old. I didn't see having a knee replacement at that age. That I probably would have needed one or two more in my life. And although the pain would have gone away, I didn't want to give up that body part. And I went on the search nationwide looking at doctors that would have some type of an option. I honestly did not know what else was out there. Ended up finding and hearing about the Stone Clinic and met with Dr. Stone, and he mentioned the term biological knee replacement. I had never heard that, and was certainly intrigued in terms of the option to keep my physical parts and to have it remedied and fixed. The actual procedures that I had done, there was actually two. One was articular paste grafting, which on the femoral bone, it's bloodying the bone and using your own stem cells to regenerate themselves and create healthy tissue. The other is called an allograft, or in essence it's a replacement meniscus with a cadaver. So in essence, the two parts of the knee, which were bone on bone, have fresh tissue in there to be able to obviously provide the shock absorption that you need. I got to say that I didn't know exactly what the rehab was going to be like. The surgery was like any other surgery in terms of, you come out, you're in some type of a contraption, there's no weight bearing for 30 days, which was not a big deal because I knew it was best for the knee for healing. But I didn't know what the PT and the healing was going to be like. It takes a while. It's fresh tissue. It's not as if you're getting titanium parts and having everything brand new in there. It's fresh tissue. It takes time to heal. And I knew from talking to Dr. Stone and the folks here at in the PT area, which are absolutely phenomenal, that I needed to have patience, I needed to work hard on my physical therapy and my rehab, and in time, 3 months, 6 months, and so forth, that I would end up feeling better and noticing the progress. It doesn't happen every week. It happens probably in several week increments. As Dr. Stone told me, it's a little bit ahead. You maybe drop back a little bit and then a little bit better. It's exactly how it went. To the date today, I'm actually 9 months post-surgery. About 2 months ago, at about my 6-month mark, I went and hiked up in Yosemite, climbed Half Dome, which I had done in my good knee days. I did the whole 9-hour hike, no pain whatsoever. I can bend my knee now past 90. I couldn't bend it probably 20 degrees before surgery without extreme pain. But great flexibility, my leg's strong again, and I'm feeling fantastic. And I would say that what I thought was going to happen, or I should say hope was going to happen in terms of me feeling better, all came true. And according to Dr. Stone, it actually even gets better a year out, 18 months and 2 years. So I'm looking forward to even being stronger and having a better feeling down the road. But a phenomenal experience here at the Stone Clinic.